When movement and function are threatened by illnesses, aging, injury, pain, disability, or environmental factors, then our next line of thought after medication or surgery that might be inside or outside clinical setting is physiotherapy. This is our focus for today. You're welcome to the program Your Health, showing on NTA Channel 5 Abuja, the Unity Station, a program packed with information on health issues and healthy living. I am Salamat Ozioma Lukman. Before we start our discussion today, let's take this report and we'll be right back.
Physiotherapy, which is also known as physical therapy, is one of the healthcare professions that helps through physical rehabilitation, injury prevention, health, and fitness. Referral of a patient to the physiotherapist is mostly done by a doctor after surgery or a health event occurred. Patients are always involved in their own recovery. Treatments are done through various ways, such as massage, heat, and more. Some cases that need the attention of a physiotherapist are arthritis, backache, neck pain, knee pain, dislocation, and children are not exempted from this treatment, especially premature or children with mobility dysfunction. Patients should endeavor to avail themselves if the need arises, in order not to further complicate the injured or inflamed area.
Welcome back from that report. Now let's meet an expert to tell us what physiotherapy is and what we need to know. Do sit back and watch.
Physiotherapy is a healthcare profession. It manages both medical and surgical conditions with the aid of physical means. Now, the physical means can be the use of water, as in hydrotherapy, can be in the use of ice, as in cryotherapy. It can be in the use of machines. We call it electrotherapy. Machines such as the TENS machine, such as the ultrasound. It can also be in the use of infrared therapy. Can be in the use of exercise. It can be in the use of chest therapy, and a lot of other forms of therapies, including massage, that we use to manage disease conditions or ailments. That is what physiotherapy is all about. And so a physiotherapist is a professional in this area that uses these amenities to manage disease conditions. Yeah, a physiotherapist comes in, one, when you have pain, basically. Talking about pain. Pain such as you have back pain, joint pain, neck pain, arthritis, rheumatism, like they call it rheumatism, that's how they call it, rheumatism. Ankle pain, or you have sprain, you have strain, or you had an injury. Let's say a domestic, you had a fall, or let's say there was an RTA case and someone was involved, and there's this case of, there might even be a fracture or something. Yeah, even when the doctors manage you, even when they put on a cast, you still need a physiotherapist to teach you how to use a walking aid. I mean, using something like crutches or walking stick or something like a walking frame to be able to be ambulant and reduce your independence on other people and move around. That's when one needs a physiotherapist. Sprain and rheumatism are not actually the most commonest. The most commonest we have is lumbar spondylosis. It's low back pain. 9 out of 10 people that come in to see a physiotherapist, they have back pain. That is what brings them. So back pain is most common, followed by neck pain. For people who work in offices, sedentary lifestyles, you have to sit on a chair to look at the computer for like 6 hours in a day. So most people come down with neck pain and, of course, back pain. So these are the most common conditions we have visiting the physiotherapists. Yes, talking about that ignorance. You know, in those days, people want to just rush in and massage, igby. Assuming somebody just falls down and has a sprain, it might not even be a complete dislocation. Then you see people, they will massage. This massage and those hot things, oils that they use, might at that acute stage make that injury to get worse, because it will make it to swell up, and that swelling will now make the pain to be more. But in acute cases like that, we actually advise people not to use anything hot around the injury site. Rather, you can use the ice therapy. You know, break some ice, put in a towel, put it into water, squeeze out the water so that you are sure that the cold is coming out, and then place it at that injury. It will help to reduce the pain, it helps to reduce the swelling, or even help make it not to swell. And then it will also help to reduce the redness around that area. And another thing you can also do is try to rest the area. Now, if you have a sprain, we will say rest. The rest we are talking about is not just going to lie down, is that do not apply your whole weight. Do not put weight. Do not allow weight to be transmitted along that particular limb. That means use crutches or use walking frame, you know, things, or walking stick, you know, things that you can transfer part of the weight to actually allow that particular area or joint to rest. That is what we mean by rest. And then the ice is there, of course, the elevation is there, and then we'll also splint. If there is need for splinting, we'll splint. But then the compression is very important. You can put on a bandage or something around it to make sure that it doesn't swell up. Yes, you know, physiotherapy has grown. The awareness is coming up such that people are getting to know about physiotherapy, and they know when to visit the physiotherapist on first contact. If you had seen your doctor and they have been managing you and they have been giving you drugs, and you feel you need to see a physical therapist, but maybe the doctor, you know, feels that what you are going through is simple, is mild, that the drugs can take care of. Why not? You can walk up to the physical therapist on first contact and say, I have this pain and I really don't want to, I'm tired of taking drugs, please. Is there any other thing I can do to help the drug to work faster? And then the physiotherapist will be able to take it up from there, together with the drug you're taking, help you to manage that part. Because at the end, what actually matters is the healing that that particular joint or area is receiving. Because that goes a long way to determine what happens in the future. Some people have issues or injuries like that, and because they are not properly managed, in the future, the pain still surfaces back because that particular area has not been properly managed. But if it's properly managed, especially with the physiotherapist, it will not resurface. Well, I would say see your physiotherapist so that he or she would, you know, be able to take your height, your weight, calculate your BMI. What I mean by BMI is body mass index, and then know the exercise that will be good for you to keep fit. It's not until you have injuries, it's not until you have issues, you have pain, before you come to the physiotherapist. And if peradventure you have pain at all, feel free, go to the hospital, see your doctor, ask that you want to see a physiotherapist, you'll be referred to the physiotherapist, and then see your physiotherapist, discuss whatever the issue is, and then we'll get to manage you. For spinal pain like that, whether cervical spondylosis or lumbar spondylosis, when the patient comes, there are we use diverse forms of treatment to manage them, depending on how acute or if the case is chronic. Now, if it's an acute case, We might want to use ice. We might want to say, okay, let's rest the joint. You know, we might want to say, okay, we're going to be needing a splint. We're going to be needing a corset or something, or even a neck collar to be able to, you know, manage it at that point. We're going to be using a cold compress or something if it's an acute case. Then if it's something that is chronic, we might want to use heat. We might want to use the infrared therapy. We might want to use the ultrasound therapy. And then, of course, we're going to be using the electrotherapy. We're going to be using the exercise, the soft tissue mobilization. And then we're going to be, you know, asking the patient to do some active forms of exercise. We're going to give you some regimen, some things that you will do. Let's say every 2 hours, you need to do this. Every 1 hour, you need to do that. So that apart from what you do when we come to the clinic, you also help us manage you at home so that your recovery would be faster. Oh, yes, what I would say about that is that, you see, the local therapies, sometimes it works for some people. It does not work for everybody, because we have had cases whereby they have complications from these local therapies and they rush to bring them to the hospital when the cases have gone from bad to worse. So please, these people, they are trying, but because what they are doing, we do not have the documented prescription, scientific prescription, evidence-based information on what they are doing. You see, what they are doing should be documented such that even if I am in America or I am in London or I am in Canada, I should be able to follow the steps that they have followed to achieve the same results that they have achieved. That is what we call evidence-based practice. Now, because there is no evidence-based practice, one, because there is no correct dosage of whatever they use to manage these people that come to them. You see, like a pharmacist, we have dosage for drugs. When you prescribe drugs, there's a particular dosage that a child can take, and then there's a particular dosage that an adult can take. It's not the same thing. So these people should be able to put it down that, okay, for a child that has this and so, this is what we need, this is what we do. If it's an adult, this is what we need, this is what we do. So we can be able to separate what you are doing for this person from what you are doing for that person. Those things they use, those herbs they use, the active ingredients need to be tested so we know what exactly they are made up of. Now, why we need to know what they are made up of is because if there are reactions, we can be able to say, okay, this is what we can use to counter the reaction that occurs from the use of this particular ingredient and all that. So those are the reasons why we do not advise people to go seeking all these people. It's not as if what they are doing is bad, no, but we need it documented. We need it evidence-based. We need to know the correct dosage of whatever they are doing. We need to know what to do in case of emergency, in case of complication that arises, you know, from what active ingredient that they have used. We need to know what to use to counter it. Those are the reasons why we do not advise people to go there. Basically, that is what we manage pain in any disease condition, whether medical condition or surgical condition. Physiotherapy comes in, you know, we are like a pain clinic to manage the pain. That is basically the work that physiotherapists do. Now, how do we manage the pain? Like I said before, we use physical means. We can use the ice therapy, we can use the heat therapy, we can use ultrasound, we can use the TENS machine, we can use, you know, cryotherapy, we can use hydrotherapy, we can use massage. We can use, you know, whatever we can use to alleviate that pain. That is basically what we do. That is the core of what the physiotherapist does, pain management.
If you experience constant backache, joint pain, and other pain, we now know that using physical techniques such as massage, ultrasound, heat, and exercise will go a long way to improve your health and quality of life. Up next is our health code for the day. That was our code for today. Here are some health tips that can help you relieve pain. Do take a watch.
Some health issues that need the attention of a physiotherapist are neck and back pain caused by problems in the muscles and skeleton, lungs problems such as asthma, bones, joints and muscles, aches and pain caused by arthritis, pelvic issues such as bladder and bowel problems related to childbirth. Early treatment is key to having a healthy life, so see your physiotherapist early. Set a goal of what you hope to achieve. Follow your physiotherapist's advice. Carry out the exercises as instructed. Take an active role in your recovery. Take the right diet. Nutrition are key components that helps recovery and function of physiotherapy. Take proteins such as fish, eggs, and soya beans. Take food rich in fiber. Consume food rich in vitamin A, C, and E. Take water regularly.
Remember, proper rest helps reduce inflammation to an injured area. Always seek for medical evaluation when you notice pain. Moving on to our interactive segment. You're welcome to our interactive segment where we take your questions, suggestions, and comments. As we always say, you can always be part of this program by sending in your messages to the number displaying on your screen. Our first question is coming from Matthew. He wants to know how to manage arthritis. Well, Matthew, avoid living a sedentary lifestyle. But here is what our doctor has for you.
We all get older. We need to imbibe healthy living. Okay, so making sure that your body mass index is normal. And normal body mass index is between 19 to 25. How do you calculate that? Your weight in kilograms over your height squared. So if you have a weight of 80, your height is 1.5, you divide 80 by 1.5, whatever you get, you divide it again by 1.5, and that gives you your BMI. So everyone should strive to have a body mass index within normal range. As we get older, and how do you achieve that? You achieve that by eating right. So your food should contain more vegetables, fruits, proteins, particularly plant proteins, and less of carbohydrates. You'll also optimize your BMI by exercise, so not being sedentary. Everyone should take at least 150 minutes of quick paced walks every week so that you maintain an optimal BMI, and you're not carrying an excessive amount of weight, and your joints would not have to degenerate quicker than your age would allow. For gout, being able to avoid an excessive amount of alcohol, because those alcohol binges are the ones that will tend to make people have gouty arthritis. So avoiding excessive alcohol consumption and avoiding excessive plant protein consumption. So don't go and eat a whole chicken, by yourself, or lots and lots of meat, and the next day you can actually come down with an acute flare of gouty arthritis. For the infective arthritis, just making sure that when people have any infection on the skin, you don't sit at home. You have to make sure that you go and get properly treated so that that infection does not spread to involve your joint. Really, for the immune mediated, it's we have to see it, diagnose it, and treat it. There's really not much in the area of prevention for that, because we really never know who would and who wouldn't. But for someone who has a family history of systemic lupus or rheumatoid arthritis, those might be people you want to watch a little more closely, ask them questions about joint pains, joint swelling, joint stiffness. If they come up with it early, then you can actually manage them, and they do not have to go into an advanced disabling type of the rheumatoid arthritis.
Our second question is from Grace. She's saying she wants to know if taking supplements is good. I would strongly advise you against such. If you have any health challenges, visit the hospital for proper evaluation. And our last question that we'll be taking for today is coming from Abdulaziz. He wants to know more about prostate cancer. Here's what our doctor has for you.
I think it's important to say that prostate cancer currently is occurring in the 4th decade and above. So we begin to screen for prostate cancer from 40 years of age. Prostate cancer occurs when the prostate gland, which is an organ sitting below the bladder, begins to have some of the cells and it begin to multiply and go beyond their boundaries. The challenge of prostate cancer is that early prostate cancer has no symptoms. So it sneaks up on you, and that is the worrying part. And for us, we encourage patients people above the age of 40 voluntarily go to a hospital and tell them you want to check your prostate gland. Then they will do a simple test called PSA, prostate specific antigen, which usually it depends on the laboratory. The value may vary, but on the average is 0 to 4. So if it is more than 4, then they will do further tests to be able to find out whether it's likely to be cancer or not. The other thing they will do is to put the doctor will put his index finger up your backside and feel the prostate to see whether it is hard, whether it's soft, and all that. That will help him determine whether it's likely to be cancer or not. And if you decide that you want to evaluate further, you may also put an ultrasound probe into your backside to examine the prostate gland. That way, by the time you've done all this, usually the urologist will do this. By the time he has done this, he will be able to help determine whether you're likely to have prostate cancer or not. Remember, the word I'm using is likely to have, because you cannot make a diagnosis of prostate cancer without a tissue diagnosis. We need to take a biopsy, taking some cells from the prostate gland to check to see, take them to the lab to know whether they contain cancer cells or not. People tell, oh, you can do an MRI. Yes, you can do an MRI to be able to detect prostate cancer. But if you want to detect early prostate cancer with MRI, you need at least a 3 Tesla MRI we don't have in Nigeria. What we have so far is just 1.5. So they are not good enough for just early detection.
This is where we'll call it a day on today's episode of the program. If you did enjoy the program, why not join us same time, same station next week? Remember, your health is in your hands. Do have a wonderful day.